As we seek answers to the COVID-19 pandemic, we can look for leadership from one of the more prestigious research centers in the entire world, and it happens to be an HBCU.
Meharry Medical College is located in Nashville, Tennessee, founded back in 1876. The school is on the cutting edge of COVID-19 research, and we're now joined by Dr. and Professor Calvin Smith. Doctor, welcome to the show.
Hi, good evening.
Good evening. Can you tell us, where does Meharry fit into this fight, and what have your researchers and your team members learned about COVID-19?
So as you mentioned, Meharry is an HBCU. We've been producing and been one of the top producers of African-American doctors since 1876. And we also have a robust research institution. And so Dr. Donald Alcindor is one of our leading researchers, and he's been heading up our efforts to create an antiviral drug for corona.
Well, the latest drug we're hearing about, Doctor, as a treatment is Remdesivir. So tell us, please, what does this drug actually do, and can it be a widely effective tool?
Sure. So Remdesivir is going to be actually a very groundbreaking tool. What it does essentially is to stop the viruses from reproducing themselves by stopping the editing process. So if you think about what a virus does, it inserts its DNA into a cell and causes that cell to reproduce that virus itself. So Remdesivir stops the actual reproduction, stops the proofreading, and will halt the progress of the virus right then and there.
Interesting. Now, what about the price of this? We're told that they haven't decided for sure exactly how much it will cost, but it's likely to be expensive, something many African Americans won't be able to afford. Is that your understanding?
Yes, that's unfortunately my understanding as well. In researching the price and price points for other antiviral drugs that come out, this is in keeping with that. It's around the price range of about $4,460 per person. That's what's being predicted, and I wouldn't be surprised if it was just a little bit higher than that even.
Wow, that's sticker shock indeed. Now, Doctor, let me ask you this. Where do we stand with testing in this country? Do we have a percentage number, a hard number of Americans who've been tested? And is there more than one type of test out here that's more reliable than perhaps others?
Sure. So the CDC keeps some pretty hard numbers about the testing that has been officially done. They've had a consortium of the number of labs that have been doing testing. And according to their numbers, it's about 0.2 of the population of the United States, 0.2% of the population of the United States. There have been some other estimates that have been a little bit more liberal that have shown maybe about 1%. But even that is a mind-boggling low number.
So what can we expect to see this fall and winter? We are told, that they're trying to get this under control, but what are your team members saying?
So we're expecting to see a spike in cases in the fall and winter. We're preparing for such. It's good that we know a little bit more now about the virus and a little bit about how to contain it, and it's all really going to go back to social distancing, unfortunately. This looks like until we have enough people who have an immunity to it, who have been exposed to it, it's going to be something that's going to affect a large number of people.
So in your professional opinion, Doctor, watching all of these states reopen, are they doing so too early?
It's my opinion that yes, they are opening a bit too early. I'm a big sports fan. I make a lot of sports analogies, and I'm a Falcons fan. And it's a lot like that Falcons Super Bowl. We got a lead 28-3, not quite even that big of a lead, and we are basically pulling the defense out. We need to be continuing to do what we're doing right now in order to keep those numbers down and to continue to flatten that curve so we can keep our resources available to the people that really need it.
Interesting. I'd actually like to ask you about the students there at Meharry. Wanting to be doctors, but then being in school and a pandemic like this happens. Are they properly trained? Do they feel comfortable? Do they still want to be doctors? What's kind of the sentiment that you're hearing from them?
So Meharry tends to attract a pretty special group of students, and our students have been very enthusiastic, and I would even argue have been instrumental in our screening and our process here in terms of testing the people in the city of Nashville. Our students have been on a bit of a pause as far as our regular curriculum, but we've adapted to those changes, and all of them are super enthusiastic about becoming physicians and helping decrease the health disparities in the United States.
Good to hear. That's wonderful.
You guys are doing a wonderful job there. You have been over the years. One of our own is one of your own. Of course, that's Dr. A. Baird, class of 1994. I was interested to find out. And it's also nice to see a fellow Falcons fan, so very good. Dr. Calvin Smith of Meharry Medical College, thank you so much for your time.
Thank you guys so much.